Hi, this is Dr. Martin, and welcome back to The Medical Message. So, today we're going to talk about something many people may struggle with but rarely discuss openly, and that is cannabis withdrawal. So, even though cannabis is often viewed as harmless or natural, your body can still react when you stop using it, especially after daily or long term use. So, in this video, I'm going to break down the symptoms, the timeline, why this happens, and practical steps to get through withdrawal safely. This is meant for educational purposes only and is not your personal medical advice. So let's get started. Cannabis withdrawal is uncomfortable, but it's not usually dangerous. People often will experience irritability or anxiety, trouble sleeping. This is one of the most common symptoms. Nausea and vomiting, especially if you had symptoms of Cannabis Hyperemesis Syndrome. Check out one of my previous videos regarding that topic. You may have a decrease in your appetite, mood swings, sweating, chills, or headaches. Most people say it feels like they're emotionally off, restless, or just physically unsettled. These symptoms will usually start 24 to 48 hours after stopping. So why does withdrawal happen? So your body has its own built-in endocannabinoid system, which regulates mood, sleep, appetite, and stress. So when you use cannabis regularly, your brain adjusts its receptors. When you suddenly stop, your brain has to readjust or reset, and that creates withdrawal. This isn't punishment, it's physiology. It's your brain sort of recalibrating. So how long does it last? For most people, the symptoms peak around day 2 to 4. By 7 to 10 days, things start improving. If you've used cannabis heavily for years, sleep issues or mild irritability can last several weeks, but this too will generally fade. One specific symptom people don't often expect is nausea or vomiting. Some may experience a condition called Cannabinoid Hyperemesis Syndrome, or CHS. So if you find yourself taking repeated hot showers for relief, that's a classic sign. Stopping cannabis is the treatment, but the treatment may lead to withdrawal, which can temporarily make the nausea worse before your body is actually able to readjust. So here's some practical tips on what can help during withdrawal. First of all, hydrate and electrolyte replacement. If you have nausea and vomiting that is severe, then that may need to be treated as well. Sleep support, melatonin may be helpful. Prioritize a consistent nighttime routine. Eat small smoothies, soups, toast, anything gentle, small, gentle meals. Avoid triggers. So if quitting cold turkey feels overwhelming, taper gradually. Hot showers may help temporarily if you've had cannabis hyperemesis syndrome symptoms. Emotional support. Withdrawal can feel very isolating, so reach out to someone you trust. Professional support if vomiting becomes severe, you can't keep anything on your stomach, you may need IV fluid hydration. And if anxiety or depression worsens to the point that it interferes with your daily activities, get medical help. You are not alone in this. Cannabis withdrawal is temporary, it's uncomfortable, but it does get better. Your brain and body simply need time to recalibrate. So if this was helpful, please like, share, and subscribe for more physician-based health education from Dr. Miriam Martin, that would be me. And remember, healing is possible and you are capable. Have a blessed day.